Welcome to AtlantiCare's Total Joint Replacement Pre-Surgery Education class. My name is Marissa Harris and I'm an orthopedic nurse at the AtlantiCare Center for Orthopedic Surgery. On behalf of AtlantiCare, I would like to thank you for choosing the Center for Orthopedic Surgery and embarking on your joint replacement journey with us. We will discuss how to prepare for your surgery, what to expect on the day of surgery, what to expect after surgery, your discharge planning, and what to expect after discharge. AtlantiCare Center for Orthopedic Surgery is dedicated to orthopedics. We opened in June of 2020. There are 6 operating rooms, 15 post-anesthesia care units, with 4 fully equipped private rooms specifically for same-day total joint patients. It is important to be in the best health possible prior to your surgery. If you plan on getting the COVID, flu, or pneumonia vaccines, get those at least 1 to 2 weeks prior to your surgery. Remember to wash your hands frequently and avoid people that are sick. If you are overweight, try to reduce your fat and calorie intake, drink plenty of water, and avoid high-calorie sugary drinks. If you smoke, now's the time to quit. If you need resources to help with weight loss or smoking cessation, you can visit the AtlantiCare website or call the AtlantiCare Access Center at 1-888-569-1000. To prepare your body, exercise prior to surgery. This helps to improve strength, range of motion, and endurance. Walk at least twice a day for 10 minutes and perform strengthening exercises. We highly recommend an evaluation by physical therapy prior to your surgery. It is a great opportunity to see your baseline prior to your procedure. A physical therapist or a recovery room nurse will be evaluating you for discharge on the day of your surgery. Enhance your health. Healthy eating and proper nutrition helps build your immune system. Eat a well-balanced diet. This should include high iron options such as lean red meat, dark green leafy vegetables, raisins, and prunes, and high vitamin C options like oranges, cantaloupes, and tomatoes. Drink plenty of fluids and stay hydrated. It's a good idea to purchase these over-the-counter medications prior to your surgery. After surgery, you will be taking aspirin twice daily to prevent blood clots. You may want to purchase Prilosec. While taking aspirin, this will help to prevent stomach upset. Colace is extremely important while taking narcotics. This will help to soften your stool. Narcotics tend to increase your risk for constipation. This is one of the #1 complaints from most patients. In addition, your surgeon may prescribe antibiotics. Taking a probiotic supplement during your antibiotic treatment can help keep the beneficial bacteria in your gut while reducing the side effects associated with antibiotics. Preparing your home. Prepare quick, easy meals and place them in the freezer. Make your walkways clutter-free, and your stairs should have railings. If you have a 2-story home, think about how you can limit your trips up and down the stairs. Prepare your shower with a grab bar. You will need a firm chair to sit in, and arrange for family support in a comfortable vehicle to go home in. Prior to surgery, you will have a comprehensive medical evaluation at the Center for Perioperative Medicine. Pre-admission testing, or PAT, before surgery reduces any possible complications. You will receive a phone call and then make an appointment for an on-site visit. There are 2 convenient locations. The Egg Harbor Township office is located at 2500 English Creek Avenue, Building 1200, 2nd floor, Egg Harbor Township, New Jersey, 08234. They can be reached at 609-677-6000. The Manahawkin office is located at 517 Route 72, West Manahawkin, New Jersey, 08050. They can also be reached at 609-677-6000. For directions to either location, visit www.atlanticare.org or call 1-888-569-1000. 1000. During the pre-visit phone call, a nurse will obtain your medical and surgical history along with any medication information. Then you will schedule your on-site visit at the location that is most convenient for you. At the on-site visit, you will meet with a perioperative APN or physician. This should take about an hour. They will perform some tests to obtain lab work, an EKG, and a urine specimen if necessary. You will receive the surgical wash and instructions on how to use it. Before leaving, they will give you a patient education booklet with instructions about your medications and if you should be taking them on the day of surgery. This is very important. As mentioned, a bottle of surgical wash will be given to you at your Center for Perioperative Medicine appointment. The instructions can be found in the procedural guide. You will wash with the scrub 3 times, the 2 nights before surgery and the morning of surgery. Please review the detailed video with more information or search AtlantiCare Infection Prevention for joint surgery. What to bring to the surgery center? Pack lightly, loose-fitting clothes, CPAP masks, please know your settings, toiletries, cell phone with charger, incontinence pads, and all of your medications. Instructions for the day of surgery. You will receive a phone call from an AtlantiCare nurse who will give you instructions for when to stop eating and drinking, as well as your arrival time for surgery. If you do not receive a call with your time by 3 p.m., please call 609-833-9880. The day before surgery, drink plenty of fluids. The evening before surgery, drink 1 bottle of Gatorade or any sports drink. Diabetic patients are to drink water or any sugar-free clear liquid. Do not eat anything after midnight. No gum or mints the morning of surgery. Take medications as instructed by the Center for Perioperative Medicine. This can be found in the patient education booklet. As of September 4th, 2018, concept being adopted by ARMC currently, enhanced recovery after surgery literature supported increasing hydration leads to better outcomes. The morning of your surgery, drink clear liquids up to 2 hours prior to your arrival time. This should include 1 bottle of Gatorade. Again, diabetic patients are to drink water or any sugar-free clear liquids. Clear liquids include juices, low sugar or sugar-free products, broth, anything you can see through, but no milk products, liquids only. Avoid tea and coffee because these are dehydrating, and do not drink any milk products the day of surgery. Where to go on the day of surgery? The AtlantiCare Center for Orthopedic Surgery is located at 2500 English Creek Avenue, Building 1200, Suite 1201, Egg Harbor Township, New Jersey, 08234. If you went to PAT at the Egg Harbor Township location, we are located on the first floor of that same building. The main number is 609-383-6488. When you arrive at the Orthopedic Surgery Center, you will enter through the main entrance on the right side of the building. Someone from our team will register you when you arrive. Once you are registered, you will be taken back to the preoperative area. Here, our nursing and anesthesia team will interview you and your surgeon will verify the operative site. For infection prevention, you will use CHG wipes once more, along with a nasal antiseptic called Nosin. This helps to prevent any spread of bacteria through your nares. You will be given preoperative oral medications that are prescribed by your surgeon. These medications will help with pain throughout the day and help reduce inflammation. They will be taken with small sips of water in pre-op. If you are having knee replacement surgery, you will have a nerve block. The anesthesia team will be at the bedside to walk you through this process. Please designate 1 contact person to communicate with the staff. In the operating room, the nursing staff, anesthesia team, and surgeon will complete a timeout. This is an immediate pause by the entire surgical team to confirm the correct patient, procedure, and site. After surgery, you will go to your private room in the post-anesthesia care unit. Once you are fully awake and ready, a physical therapist or recovery room nurse will evaluate you. Your nursing care will include, but is not limited to, frequent full body assessments, vital signs, and incision and dressing inspection. Remember, if you have sleep apnea, please bring your mask and know the settings. You will be up and out of bed within an hour after surgery. You will be given Gatorade to replace your electrolytes, medications as needed for pain, and education on incentive spirometer use and using your call bell. Call before you fall. Surgical advances have reduced the amount of swelling and pain after joint replacement surgery. We use a multimodal pain approach. Your pain scale will be assessed on a scale of 0 to 10. Please notify staff before your pain becomes too severe. Notify the staff immediately if you have any side effects, such as nausea or vomiting. As mentioned before, you will be evaluated by a physical therapist or recovery room nurse. This will happen within 1 to 2 hours after surgery, right at the bedside. They will educate and instruct you on how to properly use your walker and cane and how to get up and down stairs. Planning for discharge. There is no place like home. Home is best. Advances in surgical techniques and medications help with faster recovery and earlier mobilization. Walkers and canes are provided by a third-party medical supply company. You will be discharged from the surgery center with your assistive devices. There is no formal physical therapy for hip replacement surgery. We encourage you to walk, do ankle pumps, and use your assistive device as necessary. Outpatient therapy for total knee replacement patients will begin at the recommendation by your surgeon. This will be done 2 to 3 times per week. You will be discharged with exercises that physical therapy will educate you on. Do these as often as instructed, walk with your assistive devices, and elevate your operative leg when resting. Your prescriptions will be delivered to the facility and given to you prior to discharge. For knee surgery, you will receive a paper prescription for physical therapy so you can contact a facility that is most convenient for you. Your follow-up appointment should be already made. If not, there will be contact information on your discharge instructions. Your nurse will also go over operative dressing and incision care. If you have staples, they will be removed at your post-operative follow-up appointment. When at home, keep your circulation moving. Do ankle pumps, stay active, and walk as much as possible. Ice the surgical area as needed. Apply ice 20 minutes on, 20 minutes off to avoid frostbite. Elevate your leg above your heart. Eat a healthy, well-balanced diet and drink plenty of fluids. Bruising is expected after surgery. You may have bruising on your thigh, around the incision, or even down the entire leg to your ankle. For total knees, you will have a tourniquet in place during surgery, which may cause the bruising. This may take days to appear and days to go away. As with any surgical procedure, there are a few potential complications to be aware of. Constipation is a very common complication. To prevent this, drink plenty of water, at least 8 glasses a day. While taking your pain medications, take stool softeners, laxatives, and probiotics. These are over-the-counter, and some examples include Miralax, Metamucil, milk of magnesia, magnesium citrate, suppository, or enema if needed. Take a laxative until you have a bowel movement. Increase your fiber intake. If you are not passing gas and have severe abdominal pain or vomiting, call 911. Another potential complication is infection. To prevent this, wash your hands frequently, keep the incision clean and dry, drink plenty of fluids. Symptoms to be aware of are increased redness at the surgical incision, swelling, warmth, or a red streak near the incision, yellowish, cloudy, or foul-smelling drainage from the incision site, fever of 101 or higher, or as directed by your healthcare provider, a tired feeling that doesn't go away, And signs of bladder infection would be burning or itching upon urination. If you experience any of these symptoms, call your surgeon or PCP. And remember, call your surgeon for antibiotics before any dental or GI procedures. Last is blood clots. To prevent this during your procedure, the OR staff will place compression boots on your legs for the entire procedure, and they will not be removed until you are able to get up and get out of bed. After discharge, you will be taking aspirin as prescribed by your surgeon, and we encourage you to walk and do your ankle pumps as often as possible. Blood clots in your legs or deep vein thrombosis symptoms are pain in your calf or thigh, redness, swelling, and a temperature of about 101 degrees. If you experience any of those symptoms, please call your surgeon or PCP right away. Blood clots in your lungs or pulmonary embolism symptoms are chest pain, shortness of breath, lightheadedness, and a rapid heartbeat. Call 911 immediately. When can I drive? Your surgeon will let you know when you are able to drive again. This is usually within 2 to 4 weeks and when you are no longer taking pain medications. Prior to driving, you should practice getting in and out of the car and pumping the gas and brake pedals. Please make sure you are comfortable behind the wheel before you drive. After you are discharged from the Center for Orthopedic Surgery, expect a follow-up call from someone from our team the day after your procedure and possibly 7 days after your procedure as well. Day 1, we will ask if you have any questions about your discharge instructions, see how you're feeling and if you have any pain, and also talk about your prescribed medications to see if they're adequately treating your pain. We will also go over your medication regimen. On day 7, we will call one last time to check in and see how you are doing. Any questions, please visit our website, call your surgeon's office directly, refer to your total joint replacement fax answers questions located in your folder that was given to you at your perioperative appointment, or email us at the address provided below. Again, we thank you for choosing AtlantiCare's Center for Orthopedic Surgery, and we look forward to meeting you.